I hope I am audible. Shanwaz, can you hear me?
Yes, sir.
Okay. So late reply, I thought that I am not audible. Okay. Okay. Are you able to follow the classes? Are you able to follow the lectures? Or you are finding some difficulties in following those lectures?
Yes, sir.
Okay. There might be some problem at your end. Um, Let us wait for some time for others to join and we will start within a matter of minutes. Okay, let us wait for 5 minutes. We will start sharp at 10:30. Okay. Am I
Morning, sir.
audible? Good morning. Can you hear me, anyone?
Yes, sir.
Okay. Is it voice is clear
So
or
if
there
you
are
put on the
noises?
mic, it will be better.
Hmm?
If you put on the caller mic, it will be better, I guess.
But caller mic will not be able. I will not be able to hear. If I put on my caller
Okay.
mic, I will not be able to. I think I will not be able to hear you. Let me try. I'm using today AirPods. Uh, yeah, in last class I have experimented with the same old method and the voice was fine, I think, with earphones. Today I am using the this AirPod. I don't know whether the voice is clear or not. So as per your recommendation, I am putting on my caller mic. Let's see what is happening. So we see the voice. Okay. So Sabita have also joined us. Welcome. Now can you hear me? Can you hear me?
Yes, sir.
Okay. Is it clear? Voice is clear?
Yes, sir.
Surprisingly, I am also able to hear you with the AirPod. So nice technology of Bluetooth that has made the life easy for us. Now, in last few classes, why I had asked you to join that because in last few classes I have seen that sometimes there is a problem with recording. So I am not getting any feedback that whether I am audible or not. So this that was the problem created. So it will be very good if you can join live, some of you can join live, and it will be a good discussion also that our mode of study is actually reading from the book, is it not? So, in last few classes, I think 10 or 12 classes, we have just a one-way monologue, a one-way lecture, and most of you were busy with other things. But I found that it was a monologue. Plus, I was not getting back a feedback regarding my sound and networks. So the recording was not, sometime was not available totally. So I have to delete all the previous means where the recording was not available. I have to delete and record it again. So there was a problem. It will be very it will be very helpful if some of you will join as means live so that I can get the feedback. Plus the dialogue mode of the Socratic way of lecture, the Socratic way of learning will be established. Okay, like our initial process we have done. It was surprisingly, we have completed 1 year of these classes and it was meant for only 3 months. But Organon is so vast a subject that it carries so uh, long time. And I'm very grateful to you also that you also have adjusted with the routine. So today, in the last class, we have actually completed up to lecture, up to observation number 10 of Kent's lecture. Today we will start with observation number 11. Okay. So please read observation number 11 from Kent's lecture. In my book, it is 233. It is 233.
Okay, sir. Okay, sir.
Page number 233, observation number 11.
The 11th observation is when old symptoms are observed to reappear.
You remember the noun? Do you remember now? NOW.
Yes, sir.
NOW. That is 10, 11, and 12. 10 was 10 was
New
new symptoms. 11th was old symptom and blue. 12th was 12th was
Wrong way.
wrong direction. Very good. Now we are in now 11th observation, that is old symptoms are reappearing. Old symptoms are reappearing. Okay. So what kind of this observation? This is a good observation. Prognosis is good. You can write in the margins that prognosis is good. Now, please read. Please go through.
In proportion as old symptoms that have long been away return, just in that proportion the disease is curable. They
What
have
do you mean by this? What do you mean by this? The disease is more curable. If the disease is more curable, the symptoms, the more old symptoms will be observable. The more curable the disease, the more old symptoms will be observable. Okay. Acha. Here you will find one common thing in your practice, that a suppressed eruption comes back. Okay. A patient consulted you for his breathing distress. Okay. Now, you on examination of the patient on case taking, you found out that there was a suppressed eruption on the hand, eczema on the hand. Okay. Now you gave your medicine and the eczema back on the hand. Okay. The same place the eruption came back. Okay. So this indicates a strong vitality and strong probability of cure. Okay, this indicates a strong vitality and a strong probability of cure. Now, this again, after giving your medicine, you found that the eczema appears not on the hand but somewhere else. But the symptoms appear, the eczema appears. Okay, again, this is, you can say it is a old symptom, but has changed its place. Now, the vitality is as well strong here also, but the probability of cure is not that much as was in the first case. Got it? Got it?
can you
So
repeat once
this
again?
okay. I am saying that the old symptom will return in proportion. The old symptom will return in proportion to the disease curable. Okay, the more the disease is curable, the more the old and original symptoms will return. Okay, this is one thing. Now I have given an example. The patient have consulted you for breathing distress, and on case taking, we have found that there was a suppressed eczema on the hand. You gave your medicine, and the eczema on the hand came back. Okay. Now, again, in one case, the eczema not came back on the hand, rather on the foot or somewhere else. Okay, have changed the place. So probability of cure is more in the first case because the old symptoms is coming back in more original fashion. Getting it? Clear?
Yes, sir.
Okay. So that was I was trying to explain that a portion of as old symptom that had long been away return just in the proportion of disease curable. Okay, now suppose that there are two, three, four, five symptoms, old symptoms were there, and now you are dealing with X, Y, Z symptoms. Now this X, Y, Z symptoms, when you are giving medicines, and that two, three, four symptoms are coming back. If all symptoms, old symptoms are coming back, the disease is more curable. If some of the old symptoms are coming back, the disease is not more curable, but less curable. If neither of the old symptom is coming back, the disease is more or less curable. Okay, the old symptom will come back in proportion to the disease curable. Okay. Now, please go ahead.
They have only disappeared because you are once studying. It, they have only disappeared because you are once studying. It is quite a common thing for old symptoms to appear after the aggravation has come, and hence we see the symptoms disappearing in the reverse order of their coming. Those symptoms that are present subside, and old symptoms keep coming up. The
Underline
physician
reverse order of their coming. Underline reverse order of their coming. What is Hering's law of cure?
reverse order of coming up of the back, no, more important
Hering's law of
organ.
cure? Yes, that is from more important organ to less important organ, from inside to outward, from newer means in reverse order of their appearance. Okay, from above downward. These are the 4 5 criteria for Hering's law. No? So one of the
Yes,
criteria is mentioned that symptoms will disappear in reverse order of their coming. Okay, next.
those symptoms that are present subside, and old symptoms keep coming up. The physician must know himself that the patient is on the road to recovery, and it is well to say to the patient that this is encouraging, that disease get well from above downward, etc. Old symptoms
Underline this.
often come.
What is that, etc.? What is that, etc.? That is trying to tell the Hering's law of cure. Above downward, from above downward, from less important, more important organ to less important organ, from inside to outward in reverse order of their appearance.
Old symptoms often come back and go off without any change of medicine. It indicates that the medicine must be laid alone.
Underline this.
If the old symptoms come back to stay, then a repetition of the dose is often necessary.
What kind of repetition? Why? What kind of repetition? Audio is very disturbed. Sanita, you can hear my voice clearly because I can also means not clearly hearing everyone's voice. Can you hear me?
You use either one, or the collar mic or the
Okay. Uh, First, off your mic. Off your mic. Okay. Now it is clear. The voice is clear. If
yes,
the old symptom, if the old symptoms come back to stay, then a repetition of the dose is often necessary. Was it clear?
yes, sir.
Okay. So just listen. If the old symptoms, now the medicine must be left. The medicine the medicine must be left alone. Number one, we have to underline that the medicine must be left alone. Underline that when the old symptoms are coming back, the medicine must be left alone. This is one point. Number 2 point is that when the old symptoms are staying back, came and stays. Now, doctor, I had have a headache 2 years ago. Now it came back and it is not going away. Now you have treated me for such and such symptoms, but this headache of 10 years back has came back and it is there and it is not going away. Now what you have to do? In this case, you have to repeat your medicine. Which medicine? Which you have given. You have to repeat your medicine. Wait for some time that the headache will go on its own. If it is not going on its own, then what you will do? Just repeat the same medicine in same dose, same medicine in same potency. Okay, so this should also underline old symptoms came back to stay then a repetition of the dose is often necessary. Okay, so this was 11th observation when the old symptoms came back. Okay, and be of very sure that this is a old symptom, not a new symptoms, not a medicinal symptoms, not a progress of disease. Okay, so whenever you are getting new symptoms, it is from either from arena of medicine or arena of disease, or it may be an old symptom patient has long forgotten. Clear? Now, the 12th observation. The 12th observation.
The 12th observation, we will notice sometimes that symptoms take the wrong direction. For instance, if you prescribe for a rheumatism of the knees or
Okay,
feet,
Anirban, your audio is disturbing. Your audio is disturbing. Please, Savita, please go ahead. Can you read for it for us?
The 12th observation, we will notice sometimes that symptoms take the wrong direction. For instance, if you prescribe for rheumatism of the knee or feet, or for a rheumatism of the hands, and relief takes place at once in the rheumatism of the extremities, but the patient is taken down with violent internal distress that settles in the region of the heart or centers in the spine. You will see once a transference has taken place from circumference to center, and the remedy must be antidoted at once, otherwise structural
Underline this.
changes will
Underline this. This is the point you should write in your exam paper, that whenever the symptoms takes the wrong direction, the remedy should be
antidoted.
must be antidoted at once. Underline this.
So should I continue?
Yes, teacher.
Otherwise, structural changes will take in that new site. When diseases go from center to circumference, going out from the centers of life, out of the heart, lung, brain, and spine, out of interiors upon the extremities, it is well. So it is that we find most gouty patients get along best are in worst condition. To prescribe for this and see the heart symptoms grow worse is most uncomfortable state of affair. For it is attended with a gradual downward tendency. Eruptions upon the skin, affections in the extremities are often good sign. I remember one thing.
Underline this. Okay.
Yes, sir.
Now, complete this. Complete this.
I remember one time I was discharged from a violent old woman with quite a considerable amount of
Billing gate. Billing gate.
billing
What is gate? What is gait? Actually, it is way of standing or way of walking. So billing gait is a particular kind of way where I gait we often see in patients of osteoarthritis. So that the woman was that he discharged Dr. K that I won't take treatment from you. Okay.
who told me that when she will call me, she will walk about, and now her ankles were swollen up with rheumatism so that she could not move. That patient got another doctor but soon died. There is a great danger in selecting a remedy that correspond only to skin and ignoring all symptoms that the patient may have.
Your audio is also disturbing. Sarita, can you put the mic a bit far from your mouth and read?
Okay, sir. Uh,
Read it again,
uh,
please.
the, the patient got another doctor but soon died. There is a great danger in selecting a remedy in responds only to skin and ignoring all symptoms may have, ignoring the whole economy and general state of the patient. Because it is true that the remedy is related to the skin alone, may drive in skin disease and cause it to disease to disappear while the patient himself is not cured. Such a patient will remain sick until that eruption come back again or locate it in another place.
So come back again or locate in another place. The disease coming back, we have discussed that in the observation number 11, the disease coming back in its exact format, that is the more curable that disease is. The symptom coming back to its exact format, exact location, the more the curable disease is. Now this 12th number observation is regarding the wrong direction. And what do you mean by this wrong direction? This importantly means more importantly, this indicates the symptoms is going from up from more important organ, from less important organ to more important organ, from outer side to inner side, from periphery to circumstances. Okay, and one exception is there, which often in is in our viva examination, our written examination, they want to hear that uh, the disease is define the Hering's law of cure. Okay, so what is Hering's law of cure? All the from outside to inside and this and that, plus from above downward. Okay, if the disease is going from above downward, that means the direction is correct. Okay, and if the disease is going from downward to above, that means also the direction is incorrect. Okay, the eruption was here and now you have treated and the patient has eruption on the leg. So this is a correct direction for the cure. This is the correct direction, but direct from the leg and you put the patient on your treatment and the eruption came back on the hand. So is it a correct direction or wrong direction? Getting my point? What is wrong direction? What we have to fix? Wrong direction is any direction disease has taken. The wrong direction is any direction the disease has taken, which is defined by Hering's law of cure. That is wrong direction. Here, now, one case I have told that the patient was on, the patient has was having eczema on the foot. Now you treated your patient and the eczema is on hand now. Is it wrong direction or right direction? Come on, this is so simple. Above downward is the right direction.
Right
Okay,
direction.
yes, from downward to above is the wrong direction.
Yes, sir.
First the eczema was on the foot. Now the eczema is on the hand. It is actually
Wrong
the
direction.
wrong direction. Okay, so this you should keep in mind that any cure, any symptom which is defined by Hering's law of cure is going in the wrong direction. But this observation basically relates with from periphery to circumstances and nothing else. You don't have to bother in your theory, but in your mind, this will be your answer. That sir, this is a wrong direction. But in your theory, this will happen. That the pain in the knee, there was a pain in the knee, and there is a pain in the elbow now. The pain of the knee has cured. Okay, and this have came several times in my observation that this is not defined Hering's law of cure. Okay, this is actually not hampering the cure. Okay, rather I will say that the knee joint is more complex in its composition than the elbow joint, than the finger joint. Okay, so it is going from a more important organ to a less important organ. Okay, so this is for your clinical purpose, not for your practical purpose. In clinic, you will see the patient having knee pain, and now he is having the small joint pain in the fingers. So it is actually going from more important organ to less important organs. Okay, not from downward to above. What should ideally happen? It should go from above downward. But we are forgetting one more point of Pare's law of cure, that is from more important organ to less important organ. Okay, for the bio purpose, you remember the Herring's law of cure, but for your practical purpose, remember this exception, and you need to justify which is more important and which is less important. Is the joint of the fingers are more important, or the joint of the knee is more important? Okay, so a patient suffering from knee pain now having pain in the joints or wrist or elbow is actually not defying the Hell's law of cure, but this is not for your final examination. Okay, so far it is for wrong and right direction. For all practical purpose, consider this wrong direction as from periphery to center. Okay, for all practical purpose, consider this from periphery to center. If there was an eczema on the hands, and now there is the eczema has been cured, and there is a breathing distress. Okay, so the disease has gone in wrong direction. That means from periphery to circumstances. Here to center. Here there was a pain in joint, and now there is a palpitation. There is a pain in joint. There was a pain in joint, and now there is a shortness of breath on walking, on exertion. There is an exertional dyspnea. Okay, can you name a disease where this happens? Can you name a disease where this happens? Anyone? Can you name a disease where this happens? That is rheumatic fever. Now this should be known to you. That is rheumatic fever. Is it not? The rheumatic fever is a type of disease which licks the joint and bites the heart. Okay, so most common valvular disease is rheumatic disease of the valves of the heart, and most common valve which is affected is mitral valve. You will be seeing lots of cases with mitral regurgitation, which is a rheumatic RHD, rheumatic heart disease. You put your seto on the right place. You don't need to differentiate between systolic murmur or diastolic murmur, or pre-systolic murmur or post-diastolic murmur. It is enough you can if you can put your seto on the right place and know that there is some defect in the heart sound, and further right further investigation, and you will get that there is a rheumatic disease of heart, and that is most probably the mitral valve has been affected, and most common affection of the mitral valve is mitral regurgitation in rheumatic heart disease. Okay, so that joint pain with fever, if it was treated with homeopathy, it would have not traveled to heart. But the suppressive treatment of that fever led to led the disease to the center, means heart. And now, what are the symptoms of this rheumatic heart disease? What will be the symptoms of this rheumatic heart disease? First and foremost symptom will be the exertional dyspnea. Exertional dyspnea, patient will complain of ডাক্তার বাবু আমি হাঁপিয়ে যাচ্ছি, আমি হাঁপিয়ে যাচ্ছি, একটু হাঁটাচলা করলেই হাঁপিয়ে যাচ্ছি। ওকে, सांस फूल जाती है ना सीढ़ी पे चढ़ने से. Whenever there is an exertional dyspnea, you need to be sure of involvement of heart. Okay, some symptoms of the heart will be, there will be pain in region of heart, there may be palpitation also. So this is an ideal example. If you have to give an example of disease which is going from periphery to center. This is a disease which is rheumatic heart fever. This rheumatic heart disease, which is a consequence of rheumatic fever. Okay, so this is one thing. Other is the eczema. Suppressed eczema leads to asthma. Okay, and there are many more you can cite. There are in appendix. Here, in appendix of Organon of Medicine, you will get lots of examples of suppression. Okay, lots of examples of suppression is there in appendix. And in appendix of Organon of Medicine, plus where the Hahnemann have discussed in chronic disease, where Hahnemann have discussed regarding soda. So there are also lots of wait a minute. I will ask you to take mark your book. This volume number 1 of chronic disease. Volume number 1 of chronic disease. Where Hahnemann is dealing with external symptoms, the development of sora, the development of sora. Okay. Page number 18 in my book. Page number 18 in my book. In this book, it is page number 18. Okay. From here, Hahnemann have shared the observation of older physicians who have seen the suppression and its effect. Suppression of skin diseases mainly. You will see.
So page number 8 is there.
Page number 18, volume 1. 18, 1 8, Artero.
Oh, Artero.
And their footnotes. Okay, you will see here those who are in their MDs, this is more important for them, and those who are doing their undergraduation, uh, it is not that important, but it is important from the point of your understanding that Hahnemann has given asthma. See, asthma has been given, and then in its footnote, the more elaborately the symptoms have been described. Next, Hahnemann has given the author's name, and then in the footnote, the violent asthma was combined with general swelling and fever. Then author's name and number 3 footnote. A man of 32 years had each driven away by sulfur ointment, and he suffered for 11 months from a both violent asthma until by drinking which juice the eruption was brought back on the 23rd day. Okay, number 4. A student was seized with the itch just as he was going to dance, for which account he had it driven out by practitioner with sulfur ointment. But soon after he was attacked by such a severe asthma that he could only draw breath by throwing his head back and was almost suffocated during attacks. After thus wrestling with death for an hour, he would cuff up little cartilaginous pieces which would ease him for a very short time. Having returned home to Austerlitz, he suffered continually for 2 years of this disease, being attacked about 10 times a day, which could not even be mitigated through the help of his physician. Okay, so this is the suppression. What suppression are caused? Are what suppression are causing? These are the examples. These are the examples in the footnote and men have given. These are more important for those who are doing their MD. See, altogether, 97 examples are given. 97 examples of suppression have been given. Okay, so this point should be noted. Have you got that?
Yes, sir.
Okay, page number 18, Savita. Okay, in this book, volume 1, page number 18, all those footnotes where the suppression have been given.
So this is also an example. Wait a minute, I have a call. The example of disease taking wrong direction. So by this wrong direction, you should remember in your clinic, that is enough if you can remember the disease going from periphery to center. Okay. Now this can happen with your medicines also. Okay. If it is happening with your medicine, that means the medicine was wrongly selected. Okay, that means you should antidote it. Okay, clear? Clear? Now, in elderly patients, their common complaint of elderly patients are joint pain. Okay, you need to remember that joint is a place of wear and tear. Okay, joint is a place of wear and tear. Now, if you are trying to forcefully drive in back the pain, it will be going to somewhere else, more important organ. Okay, so in elderly patients, while treating joint pain, be sure of not over treating your patient with your medicine. Okay, now what could you done? What can you do in your elderly patient with joint pain? You can give them some exercise. You can give them some, basically if it is simple osteoarthritis of wear and tear, you can give them of some calcarea floor. That will be a Schussler's method of replacing the calcium of old age. Calcarea 4-6x, 4 tablet thrice a day will restrict that wear and tear there. And plus, on the basis symptoms of modality, you can give your medicine. Okay. Now, you don't advise your patient to put some Iodex like thing, move, Valonese, these are the local painkillers. The steroidal injection in the knees, usually the orthopedic surgeon suggests usually that after lots of painkiller, the pain is not going back, so they suggest some steroid, local steroid. Want your patient not to take those local steroids or any sort of painkiller for knee joint pain. Okay, if possible, give your medicine with try to find out some modalities. More often you will find some modalities in your patient, elderly patient, that they are aggravated when ascending, aggravated when descending, aggravated when ascending or descending both. When walking they are aggravated, when sitting they are aggravated, when flexing they are aggravated or ameliorated, like this. Try to find out those modalities. So this will be your approach. Give some calcarea floor in your elderly patient to restrict the wear and tear, and that is from Schussler's tissue salt 6-6, 4 tablet a day. Locally, I used to, for soothing purpose of the joint, I used to give local Arjuna mother tincture locally. Okay, it is better than a steroid. Otherwise, you will be discharged by your old patient. Like Kent have been discharged by his old patient. You will be discharged by your old patient if you are not going to give some relief. If you are able to give some relief to your patient by this, uh, giving some calciums and giving some local application, maybe you need arnica for restricting the wear and tear, arnica mother tincture locally, or maybe you need Arjuna. Arjuna is actually the Indian arnica. Okay, Arjuna mother tincture locally. Not do not ask your patient to massage. Just give the local soothing. Okay, the joint is means there is a wear and tear in the joint. Local inflammation is there. So local soothing, local medicines you should give that, and that will relieve your patient, plus give your medicine on the basis of modalities. Don't go for much constitutional remedies in elderly patient, that there are chances of severe aggravation of the pain and you will be discharged by your patient. Okay, so for the knee joint pain, usually in elderly of osteoarthritic nature, our approach will be giving some calcium, and that calcium may be that many often the patient will be already taking some calcium, and nowadays there are vitamin D deficiency is so severe, vitamin D deficiency because of the small rooms and housing places in cities. So they are not enoughly exposed to sun, and they are having this vitamin D deficiency. So ask for the vitamin D test, lab test for vitamin D. It's very costly. And calcium, you don't need a calcium test because it will be actually they will take again 2,500 like that of rupees for calcium, and 2,500 like that for vitamin D. So again the patient will not stick to you, doctor बहुत महंगा test देता है. Okay, so just if you have to write a single test, write for vitamin D, and if it is deficient, ask your patient to take the vitamin D capsule from the market, from allopathic shop. It will be available there. Vitamin D, vitamins are should be prescribed when needed. Once a week, one capsule is enough for your patient. Okay, so try to replace these deficiencies as the old age is for wear and tear. Okay, what other sort of joint problem we may you can we may in our clinic, we may face in our clinic. What other type of joint problem? In joint problem, first of all, you have to see whether a single joint have been affected or multiple joints are affected. Okay. Now you have to see whether there is any swelling or not, whether there is any active inflammation or not. Okay. Now then you have to see the age of the patient, at what age he is having. Mostly if the joint pain, a single mono articular mono arthritis is there, a single joint has have been affected. So most probably in a younger patient it is most probably an acute arthritis. Okay, a single joint has been affected in a patient of younger age. It may be an acute arthritis. Okay, maybe bacterial. Okay, maybe viral, or maybe just inflammatory due to some injury. Okay, if multiple joints are affected in younger patient, be sure to rule out rheumatoid arthritis. Okay, if again a single joint is being affected in a middle-aged patient, a single joint is being affected in a middle-aged patient, don't forget to ask for a uric acid test. Okay, most often this uric acid diathesis will have a presentation of single joint affection, and that is a gouty arthritis. Okay, gout usually have tendency to locate in great toe, but nowadays I am seeing this kind of gout in knee joint also. Okay, not in the great toe, but rather more in the knee joint, and the swelling is lots of swelling. More swelling, you will be afraid to see the swelling of one night swelling, and most probably it is a acute gouty attack. Okay, so what I have told, that single joint affected in a younger patient, it is most probably is acute arthritis of bacterial or viral or inflammatory nature. If a single joint affected in a middle-aged patient, it is most probably a gouty arthritis. It may be a inflammatory bacterial or other acute arthritis, but in middle-aged, it is basically mainly it is a gouty arthritis. Okay, don't forget to ask for a uric acid test. If multiple joints are affected in a proportionately younger patient, don't forget to rule out rheumatoid arthritis and other autoimmune diseases. Okay, and for rheumatoid arthritis, there will be a peculiar stiffness in the morning. You will get a peculiar stiffness. The patient नॉर्मल करते बच्चे ना डॉक्टर बाबू हम जब नींद से उठते हैं तो हिल नहीं पाते हैं. That kind of stiffness will be there. Okay, so if a single joint is affected in a middle-aged patient, it is most probably a gouty arthritis or it may be osteoarthritis. But osteoarthritis is mostly disease of an old age. If it is not due to this osteoarthritis, I mean, if it is not due to gouty arthritis in old age person, there is this a single joint. If single joint is affected, it is most probably of osteoarthritic nature. That is wear and tear. And in this kind of osteoarthritis, you may get some history of injury also. Okay, so this is osteoarthritis. So if it is plain osteoarthritis, what happens in osteoarthritis actually, there is a space reduction and there is a destruction of bones and there will be some osteophytes. So this is osteoarthritis. So this osteoarthritis, manage this osteoarthritis, what I've told, you have to give some calcium, you have to ask for vitamin D, you have to give some local soothing mother tinctures. Like most probable mother tinctures for this is Arjuna and Arnica. If patient happen to be a great footballer of his time, think of Arnica. If the patient is having long history of prolonged walking, think of Arnica. Otherwise, it is better to give Arjuna, because Arjuna, as Arnica, Arjuna have also a anti-inflammatory effect. Okay, so local inflammation will be reduced. Clear? So this will be your mode of progress in a patient with joint pain. And if it is gouty arthritis, you have a single medicine to give. That is Artica urens. Read Gout from Burnett's book. Burnett has a wonderful booklet called Gout, and it's cured. And there Burnett has almost always prescribing for acute gout attack Artica urens in low potency. So we have Artica urens if it is gout. We have Artica urens plus a small medicine for small use in clinic. If you are sure that it is a gout, give your Artica urens in lower dilution, like 1x or 3x every half an hour, and it will subside. Okay, and will get lots of name and lots of fame and lots of money in clinic also. Okay, so for being a good to be a good homeopath, you need to have some idea regarding the disease. So you need to treat your disease and you need to treat your patient also. But you are treating your disease not by your medicine, but you are treating the disease in your mind, that what kind of disease it is. Okay, so you have to first classify the disease according to Organon, next classify your disease according to medicine, then apply your philosophy, apply your medicine. Okay, so this short discussion I have discussed regarding the joint problem we commonly face in our clinic. Very easy to handle, and if you are able to handle this kind of joint pain in your clinic, you will get lots of patients. Okay, any question you are having? Any question?
Sir.
Okay, Anil, you are telling something I am unable to hear.
Yes, sir. Actually,
Hello?
hello, sir.
Anil, one?
हेलो सुनाई नहीं आवाज सर। हेलो
Unable to hear you. You are trying to tell something, but I think I am
सर
unable to
सुनाई
hear.
नहीं आ रहा है। हेलो
Can you hear me?
हेलो सर।
Yes, you are audible. Yes, you are.
हेलो
Go ahead. Go ahead. Yes, you are audible. Go ahead.
ओके सर, हम ये बोल रहे थे ना कि ग्रुप में आपने जो बताया था वो थायरोइडिनम, फॉलिकुलम एंड एड्रिनलिन के बारे में, कार्सिनोसिन हम नहीं बोल रहे हैं। जो ये जो तीनों ड्रग है ये मतलब ये कैसे काम करता है? इट्स लाइक द इट्स वर्क लाइक द कॉन्स्टिट्यूशनल रेमेडीज और जस्ट मतलब होम्योपैथिक पैलिएशन करता है? ये जानना था। हाँ सर।
पैलिएशन कहाँ से दिमाग में है? पैलिएशन दिमाग में कहाँ से है?
सर ऐसा है ना कि जैसे थायराइडिनम और एड्रिनलिन और फॉलिकुलिन, मुझे ऐसा लगा कि जस्ट मतलब अगर थायराइड डिसऑर्डर है तो जस्ट वो थायराइड का वो मतलब हार्मोनल डिसऑर्डर को वो ठीक करता है। एड्रिनलिन का कुछ प्रॉब्लम है तो जस्ट वो एड्रिनलिन को ठीक करता है। मतलब ऐसे मेरे को समझ आया। ऐसे समझ नहीं आया कि वो कॉन्स्टिट्यूशनली पेशेंट को ठीक करेगा या नहीं, वो समझ नहीं आया था।
अच्छा, अभी समझ में आया?
नहीं आया सर।
ओके, कौन सी चीज? देखो, हम तो ये नहीं बोले कि तुमको एड्रिनल का कोई प्रॉब्लम होगा तो एड्रिनलिन देना है, थायराइड का कोई प्रॉब्लम होगा तो थायराइडिन देना है, ऐसा बोले थे क्या?
नहीं सर, ऐसे तो नहीं बोले थे, लेकिन मतलब सपोज पकड़ लीजिए कि स्ट्रेस की वजह से थायराइड डिसऑर्डर हो गया है या ग्रीफ की वजह से थायराइड डिसऑर्डर हो गया है, तो उस हिसाब से
फिर से बोलो, हम सब सुने नहीं तुम्हारी बात.
सर हम ये बोल रहे हैं पकड़ लीजिए कि ग्रीफ की वजह से सिर्फ उसका थायराइड डिसऑर्डर हो गया। हेलो हेलो
फिर से बोलो. So the point Anirban was asking regarding the prescription of thyroidinum, that while I think he have misunderstood that whether there is a thyroid problem we have to prescribe thyroidinum, whether there is adrenal problem we have to prescribe adrenaline. That is not the case. Okay, where there is a thyroid problem you have to give thyroidinum, that is not the case. Okay, I have given an indication that if there is a history of stress, if there is a history of stress, think of these medicines. Okay, and this is a causation. Like if someone is someone has got wet in rain and after that it has started. Okay, if someone has got wet in rain and after that the disease is started, if someone is having grief and after that the disease is started, think of this medicine. So causation is important. From the viewpoint of causation we have told. But now that your point is that whether this medicine will palliate or cure. No, it will not palliate, rather it will cure, because you are giving it on the indications. Okay, and that getting wet in rain, पानी में भीग गया, उसके बाद फीवर. तो अब इसमें पानी में भीगने के बाद फीवर हुआ या फिर पानी में भीगने के बाद पेट दर्द हो रहा है. ठीक है, अगर पानी में भीगने के बाद पेट दर्द हो रहा है, causation is there, then you may think of Allium cepa. Allium cepa is also a very good remedy for this getting wet in rain. Okay, and the manifestation will decide. But this is an indication you should keep in mind, that getting wet in rain, this is one of the indications for our nostocs. That try to search nostocs in your patient. Okay, according to symptomatology. In the end, the symptomatology will decide that two persons, according to their inbuilt constitution, they will react to certain cause. Okay, एक आदमी को एक थप्पड़ मारे और उसने जाके सुसाइड कर लिया, और एक आदमी को एक थप्पड़ मारे तो कुछ देर चुपचाप रहा, फिर ठीक हो गया। तो दोनों का कॉजेशन सेम था, बट दे रिएक्टेड अकॉर्डिंग टू देयर इनबिल्ट कॉन्स्टिट्यूशन। जो थप्पड़ मार के सुसाइड किया उसको ऑर्गेनोमेट लग रहा है। ओके
Yes, sir.
ओके, एंड जो थप्पड़ मार के चुपचाप हो गया, फिर बाद में कुछ ग्रीफ हुआ, उसको कोई और मेडिसिन लगेगा। जिसके अंदर सुसाइड का टेंडेंसी था उसको ऑर्गेनोमेट लगा, बट दोस causation may be same for those two people. Okay, causation is same, and you can think of all the medicine which is covering that cause. Okay, where in which direction the disease will go, that will be decided by the constitution of that patient. Okay, so stress is there, stress is there, and this stress, where this stress will lead, where this stress will lead that patient, it totally depends upon its inbuilt constitution, its share of psora, psychosis, and syphilis. Okay, and that effect, that direction will decide the medicine. But you should keep in mind these medicines. For stress, remember folliculinum, thyroidinum, carcinosin, and adrenaline. For stress. Okay, but in which condition, what to give, that will be decided by the symptomatology, isn't it?
Yes, sir.
Yes, yes,
Okay,
sir.
Anirban, here it is now.
हाँ सर, अभी समझ आया। मतलब हम ऐसे सोच रहे थे कि वो मतलब पैलिएशन की तरह काम करेगा, मतलब स्पेसिफिक टाइप हुआ, लेकिन नहीं, अभी समझ आया।
Oh, very good. Chalo. Savita, do you have any question?
No, sir.
Okay. Thank you. Thank you, Anirban.
Thank you, sir. Thank you, sir.
Hello. Bye. हाँ बैठ। ये क्या है? फर्स्ट टाइम है मेरे पास, पहली बार आए हैं जी सर। अच्छा हाँ तो 2021 का आप रिपोर्ट दे रहे हैं। 2021 का रिपोर्ट का हम क्या करेंगे? क्या प्रॉब्लम है गले में? बहुत दर्द था पूरा सटा हुआ हाँ हाँ
कहाँ पे रहता है बताइए?
ऊपर कैसा?
बस हाँ, बोलने वाले में कोई तकलीफ तो नहीं है क्या? हाँ हमारे रहते हैं तो ऐसे नहीं ठीक, एक मतलब खाना चाहिए 2-3 मतलब एक बार सिर्फ नया करके खराब हो जाएगा। तो क्या काम करते हैं आप? भारी भारी सामान काम करते हैं। अभी आपको पेशाब के रास्ते में इन्फेक्शन हुआ है, ठीक से याद करके बोलिए। अभी बस आया है पेशाब के रास्ते से, इंजेक्शन एक के बाद माउथ पे लगाना पड़ा। क्या करता है बराबर क्या क्या हुआ आपको? हाँ, ये वाला जलना उसके बाद से तो नहीं शुरू हुआ ना? अब ये गिरना, नहीं ये चलना कब से शुरू हुआ? गिरने के बाद से शुरू हुआ है। क्या होगा? क्या घबराहट? अभी किसको? बच्चा मर हो जाएंगे और से पता चावल से खाना खाएं खाने में दिक्कत है तो उठने के साथ जाते हैं फौरन बाहर जाना पड़ता है। उठे फौरन गए टाइफाइड
शुगर का कैसे
पहले वाला दबा लीजिएगा, एक ढक्कन करके 3 बार लेना, ठीक है? डायरेक्ट करना, कुछ नहीं, डायरेक्ट दिन में 3 बार। वो खत्म हो जाए फिर ये वाला दो, एक ढक्कन करके 2 बार, सुबह शाम। ठीक है, हाँ वैसे एक बार ऐसे ठोक लीजिए, ठीक, एक ढक्कन सुबह, दोपहर, रात, खत्म किया फिर ये वाला एक ढक्कन सुबह, रात। हाँ ठीक है, कोई दिक्कत होने से हमको फोन कीजिएगा, ये मेरा नंबर है, हम यहाँ से संडे को रहते हैं, बाकी दिन वहाँ कॉल कर, ठीक है? कोई दिक्कत होने से फोन करेंगे। हाँ ये टेस्ट करा दें। हाँ मिलाना नहीं, कुछ नहीं है। फर्स्ट टाइम है, फर्स्ट टाइम रिपोर्ट कागज है आपके पास? लास्ट ईयर फरवरी है, से ऑपरेशन। अच्छा, इसके बाद से यहाँ पे ट्यूब में था, दो बार मैं 2015 की दोनों साइड एक ही ट्यूब में हुआ है, एक ही साइड के ट्यूब में हुआ है। दोनों निकालते हैं। एक ट्रीटमेंट हुआ था लास्ट ईयर जब ऑपरेशन हुआ ना, डॉक्टर ने इसको काट के निकाला। उसके बाद इसको ऑपरेशन की प्रेगनेंसी वॉमिटिंग का प्रॉब्लम, कई बार डॉक्टर देखा है तो मेडिसिन देता था, थोड़ा दिन रिलीफ होता था, रिसेंटली अभी डॉक्टर को देखा है आपका पीरियड्स में लो है, अपर एब्डोमेन और लोअर एब्डोमेन ऑपरेशन किया था, स्पेसिस्ट कर लिया और सीओडी बच्चे हैं आपको? हाँ कितने बच्चे हैं? 2 बच्चे। सोन भाई है ना, शरीफ भाई, हाँ सोन भाई के साथ है। अच्छा, तो यही रहते हैं, रहते हैं। हाँ सिर्फ संडे को रहते हैं। हाँ एक्चुअली आपका चैम्बर है ना, हाँ स्टूडेंट लोग साथ हैं, स्कूल टाइम, हाँ आप लेकर आए कहाँ रहे ठीक है, ये अच्छी बात है कि बच्चे आपको है। अभी तो गॉल ब्लैडर में ये हो रहा है ना, स्टोन फॉर्म हो रहा है, स्टोन हुआ नहीं, फॉर्म हो रहा है, इसके लिए तो बच्चे देखिए हो जाते हैं। पत्थर बन गया होता ना तो हम रेफर कर देते सर्जन के पास, क्योंकि एक बार पत्थर बन जाने के बाद कोई इलाज नहीं है उसमें। पत्थर अभी नहीं बना है, ये सीओडी के लिए दवा देते हैं। अभी तकलीफ क्या क्या हो रही है? आप वोमिटिंग कब से शुरू हुआ? कौन सा ऑपरेशन है? थेरेपेटिक वाला? ठीक। ऑपरेशन के बाद से वोमिटिंग शुरू हो गई। और कैसे समझ में आया है हेमोग्लोबिन का? हेलो, ठीक। चक्कर भी आता है आपको? जैसे बैठ के खड़े होने से आँख के तरह अंधेरा हो जाता है। ठीक। और हाँ, सोचने से। और गैस में क्या प्रॉब्लम होता है आपको? ये कब से हो रहा है? वही ऑपरेशन के बाद 2 बार हुआ है ट्यूब ऑपरेशन, मतलब एक्टोपिक प्रेगनेंसी 2 बार हुआ है। लास्ट कब हुआ है? 2021 को। सबसे पहले 2015 में। बीच में कोई बच्चा हुआ है? ठीक। अच्छा, और क्या क्या बड़ी तकलीफ हुई आपको ये ऑपरेशन के अलावा? और कोई क्या ऑपरेशन? बच्चा टोटल दोनों ऑपरेशन से हुआ है। ठीक है। और 4 ऑपरेशन। ठीक है। टाइफॉइड, जॉन्डिस, मलेरिया कुछ हुआ है? जॉन्डिस होता है 40 से पहले। और कभी कोई जानवर, कुत्ता, बिल्ली, सांप, बिच्छू काटा है? अम्मी अब्बू आपके हेल्थ से हैं? उनको कोई तकलीफ है? थायराइड, प्रेशर, शुगर? अच्छा। और आपको को थायराइड किसी को है भाई बहनों में? अच्छा, फैमिली में ननिहाल में, ददिहाल में कोई बड़ी तकलीफ, कैंसर, टीबी, खाला, मामू, चाचा, फूफू, जितना पता है किसी को कैंसर हुआ है, टीबी हुआ है? सब ऐसे लिखो ना। और आपको कभी टीवी में तो नहीं हुआ है, वो कैसी लगती है आपको? खाने में शौक से क्या खाती है? मीठा, नमकीन, तीखा, खट्टा? ज्यादा पसंद क्या है? पसंद नहीं मीठा, नमकीन। शौक से क्या पसंद? सब, गोश्त, मछली, अंडा, दूध, मक्खन में शौक से क्या पसंद नहीं करता? इन दिनों ऐसा हो रहा है ना। ठीक है, ऐसी कोई बात, ऐसा कोई खाना है जिसको खा के उल्टी होने लगता है, तब काफी बढ़ जाती है? ठीक है, पानी की प्यास कैसी लगती है? कितना लीटर पानी पीते हैं डेली? ठीक है, पानी खाइए। खाना पेशाब में कोई दिक्कत है? हाँ? खाना सुबह उठते के साथ जाती है, खाना से जाती है? पेशाब में कोई दिक्कत? मन मिजाज कैसा रहता है? टेंशन मतलब कुछ नहीं क्या? कैसा है? गुस्सा आ जा रहा है जल्दी? ऐसा कोई बात है जिसको लेकर बहुत गुस्सा आया? नहीं, ऐसी कोई बात हुई है जिसको लेके बहुत दुख हुआ है? ऐसी कोई पर्टिकुलर बात हुई है इतने दिनों में जिसको लेके बहुत दुख हो गया है, किसी की बात बहुत बुरी लग गई है, किसी का रवैया व्यवहार बहुत बुरा लग गया, गुस्सा आया है, दुख हुआ है? इतनी सारी तकलीफ है इसलिए पूछा। कौन कौन है घर में? क्या जॉब करते? क्या करती है? ऑफिस है ना आपका? करना क्या पड़ता है? दोस्त में कितना लगेगा? चिड़चिड़ाहट ज्यादा है, गुस्सा भी कर देंगे, किसी के ऊपर चिल्ला देंगे, अच्छा कुमार वाले गुस्सा ही नहीं करती, किस पे चिल्लाती? हाँ, गुस्सा नहीं करती, ऐसा नहीं चिल्लाती। अच्छा, तो ड्राइंग फैमिली में काम वाम का ज्यादा प्रेशर रहता है? नहीं, काम सब करने वाला काम करता है, मम्मी की पर्सनैलिटी किसी का ऐसा कोई प्रॉब्लम नहीं है। आपका अकेले रहना ज्यादा पसंद आता है ना? भीड़ भाड़ अच्छा नहीं लगेगा? अच्छा, चलने फिरने से भी हाँफना हो जा रहा है? महंगा ठीक आता है आपको? पेन होता है बहुत ज्यादा? पूरे जब से महीना शुरू ऐसे ही होता है?
जब से ऑपरेशन हुआ है सारा डॉक्टर का मेडिसिन चल रहा है। ठीक, साला पानी भी देता है, दिखोया भी देता है, पर डिस्चार्ज होता है। ठीक है, दूध कैसा लगता है? हाँ, गर्मी ज़्यादा लगती है आपको? ज़्यादा लगती है? हाँ, ठीक है, ठीक है। जो मेडिसिन ये चल रहा है सब फाइल की छोड़ सब मेडिसिन जो है छोड़ ये से ये छोड़ ये चल रहा है उसका लीवर का प्रॉब्लम और इसका लीवर से ये मेडिसिन है और ये कितने दिन खाने बोली हैं? ये बोला 3 महीने के साथ साथ क्या लीवर उसका सिस्टम है और तो हेपाकाइन वगैरह खाने की जरूरत नहीं है। ठीक है, उसके लिए हम लोग अपना दवा नहीं दे रहे हैं। जो दवा रेगुलर खाते हैं रेगुलर खाइए, बंद नहीं कीजिए। अभी 2 हफ्ते की दवा देते हैं, अगली बार जब आएंगे तो फिर 1 महीने की देंगे। ठीक है, कैसा रहता है देखने के लिए बता दीजिए। हाँ, जो है फ्लश ठीक हो जाता है। लिपिड प्रोफाइल कितना रहता है? लिपिड कोलेस्ट्रॉल तो उससे चर्बी वाला सामान कोलेस्ट्रॉल नहीं किया जाएगा, कोलेस्ट्रॉल नहीं किया तो उसको थोड़ा सा रफेज ज्यादा खाइएगा, गाजर, खीरा, पपीता, ये सब चीजें ज्यादा खाएंगे आप। ठीक है, और चर्बी वाला दोस्त नहीं खाइएगा, ये डालडा वाला सामान नहीं खाना है। बिरयानी अक्सर कलकत्ते में बाहर की आपको डालडा की मिलेगी तो नहीं खाना है। ठीक, घर पे जो बिरयानी बनेगा रिफाइंड ऑयल में वो खा सकती हैं, डालडा वाली बिरयानी बाहर की नहीं खाएंगे आप। ठीक है, सब खा सकते
जो रिस्ट्रिक्शन में बताती है, इसके अलावा कुछ नहीं, सब खाएंगे, कच्चा प्याज, खट्टा अचार सब खा सकती हैं। होम्योपैथी दवा के साथ बहुत सारे लोग बहुत सारे रिस्ट्रिक्शन लगाते हैं, मेरे साथ कोई रिस्ट्रिक्शन नहीं, सब खाएंगे। बीमारी का परहेज है, मेरी दवा के साथ कोई परहेज नहीं। एक नंबर दवा पहले शुरू कीजिएगा। ये वाली दवा पहले शुरू करें। 3 टाइम लिखा हुआ है इसमें, एक अटेंड करके ये खत्म हो जाएगी। ऐसे सहूलियत करके 2 बार लेना, आधा कप पानी मिला। ठीक, ये एक खून के लिए आपको चक्कर करा रहा है, खून की कमी की वजह से ये 4 टैबलेट करके ठीक है। चलो नहीं दवा, इसमें कोई दिक्कत होने से हमको फोन कर दीजिएगा। नहीं पहचान पाए तो आप इस पे एक बार व्हाट्सएप डिस्क्रिप्शन कर दीजिएगा। ठीक, हाँ 10 दो। समझ नहीं दवा बोलिए कैसी हैं? क्या हो गया? कल से परेशान है भाई। सीना में दर्द दे रहा है। हाँ? तेल लगाना है, उतना में तो दर्द नहीं होगा। उतना में पैर में आपको दर्द होता था, तलवा में दर्द होता था।
चुभना वाला दर्द होता था तलवा में, वो क्या है? चुभना का कहाँ से मिलते हैं नया? दवा हम लोग का कब पता? 4 नंबर चल रहा है, 4 नंबर दवा चल रहा है, पूरा खत्म नहीं हुआ है। आपकी कैसे हो गया? बुखार भी है। ठीक हो रहा है? बार बार हो रहा था, ठीक है। आपसे दर्द है क्या? दर्द हो रहा है, किस वक्त हो रहा है? चलने फिरने से हो रहा है क्या? हार्ट वाला ड्रॉप भी खा रही है क्या? नॉर्मल है, क्या दिखा रहे हैं?